Hi, welcome again to Cadaver Confessions. Sorry about the whole break in the middle thing. We're going to be progressing very regularly with quick updates for you guys. Right now we're going to be focusing on plant poisons, and in plant poisons we're going to be doing three major ones today. Now these plant poisons are important from the MCQ point of view as well as from the short answer question point of view. Very commonly asked plant poisons, especially in forensic medicine and toxicology internals and university examinations, are going to be among the three that we will be discussing today. Now, what you intend to learn from this particular experience is that today's particular lesson is that first and foremost you should be able to describe what are the symptomatology of these particular plant poisons. They are very important. You have to describe the typical features because many of the features are going to be overlapping between them. So you need to know the typical presentations of these particular plant poisons. You have to know their management strategies, and after that you have to explain the medico-legal importance. Every particular toxin has its own medico-legal importance, which is going to constitute a big bulk of the marks that you're going to be acquiring. In forensic medicine, unless you place the medico-legal importance in the answer, you won't get marks. Everything has medico-legal importance, whether it has been asked specifically or not. Now we move ahead. First and foremost, like every episode, we're going to be starting with a case history. Now, till now, I've been doing a little bit of fabricated cases or simulated case scenarios. Today, I'm going to be telling you the actual case of Georgi Markov. This is a case from 1978 in London. Now, Georgi Markov was a photojournalist. He was originally of Soviet or Ukrainian descent. He had emigrated to London, and what he was doing there is that he was trying to expose the wrongdoings that were happening in the communist regime in Soviet Russia. So he was trying to focus on all of that. He was working with the British Broadcasting Service or the BBC. Now this individual was standing at a bus stop one fine day, and there he happened to see an individual standing next to him wearing a long overcoat and carrying an umbrella. It was a long umbrella, the kind of ones that older gentlemen use with the twisted handle and the long umbrella with a metallic snout. So they was using that. While this person was standing next to him, he hurriedly, the one who was wearing the overcoat, hurriedly ran past Georgi Markov. He brushed his leg with the umbrella, got into a car and left him. Georgi didn't bother much about it. He came back to his residence. Thereafter, he started developing symptoms such as fever, cough, nausea, vomiting, and bouts of diarrhea. Thinking it must have been just a flu, the family did not focus much on it because, of course, every one of us suffers from viral symptoms every now and then. They did not think much about it. They went ahead and they started doing some home remedies initially. Thereafter, these individuals, what they happened is, the progression of the disease was higher. It was not very self-limiting in nature. As the condition deteriorated, they went ahead and they contacted the doctor. The doctor started treatment based on viral gastroenteritis lines, was not successful, and Georgi Markov passed away. After his passing, there was always a suspicion that there is some element of murder involved or foul play involved. They did an autopsy and they found this particular component in the calf region of Georgi Markov on autopsy, and this actually is a small ball bearing. The entire dimension is 1.7 millimeters. It's very small. It's less than 2 centimeters in diameter. It's 1.7 millimeters. And if you look at it, it's such a small thing, and it had 2 burr holes right here in which some sort of a poison was placed, which caused this individual to die with symptoms initially that were resembling a viral gastroenteritis. So it has to be something that's very strong, that's very potent, is having symptoms that are very similar to a natural disease, and what that particular poison was is something that we're going to be doing next. First, there are certain terms that you should be aware of. The first term is what is exactly a toxalbumin. We're going to be hearing a lot about this in plant poisons. So a toxalbumin is also called as a phytotoxin. This basically is a protein. You see that it's a protein, and this particular proteinaceous compound will resemble either a bacterial toxin or it will resemble a sort of a viral radiopathology. And what it does is it causes either agglutination of red cells, either it causes hemolysis, either it causes antigenic reaction. It causes one of those reactions that you typically see in cases of infections. And they are all toxalbumins are those which are produced by a plant. They are produced by a plant. Few of the toxins are Ricin, Croton and Abrus, all three of which we are going to be focusing on today. In terms of biotoxicology, this is a small division that is very routinely asked in vivas, not so much in exams, written exams, but in vivas. Biotoxicology basically divides biotoxins or animal or plant-based toxins or organic toxins into two major categories. You have your animal toxins. This includes your venom from various species such as snakes, spider, jellyfish, so on and so forth. And then you have the plant poisons. Now, plant poisons can be irritant in nature. Either they cause some sort of irritation to the skin. They can be deliriant plants that cause some problem with the behavior of the individual, affecting the psychological nature. It can be cardiotoxic in nature, specifically affecting the heart or the cardiovascular system. And there can be neurotoxic in nature, specifically attacking the nerves, which can either be peripheral or central in nature. Common plant irritants are, common plant irritants are, the first and foremost, the one that we will be studying today is Ricinus communis. Ricinus communis is a very common plant, and I'm sure most of you know what it is. In case you do not, Ricinus communis is the plant that we call castor. In Hindi, the oil extracted from Ricinus communis is called Anandika tel. It's castor. That is what the Ricinus communis is. Second, you have something called as Croton tigeum. Croton tigeum is the second one that we will be doing today. The third one is going to be Abrus pregatorius. In this particular episode, we are going to be focusing on only these three, and in the coming episode, we are going to be focusing on capsicum, we are going to be focusing on Semicarpus anacardium, and then we are going to be focusing on Calotropis gigantica. What exactly is Ricinus communis? Now, as I told you before, Ricinus communis is nothing but it's actually the castor plant. So, brothers and sisters, these are actually castor plant has a very common component of poison in it, which is what we're going to be studying today. This is what Ricinus communis ka plant looks like. It looks very harmless, it looks very pretty. It has these reddish sort of stems, brightly colored leaves, it has those flowers. Now, it's overall a very appealing thing, not disclosing the fact that it's actually going to be very dangerous. Ricinus communis or castor plant actually has the seeds which are the main source of the poison. The stem and the leaves may not contain the toxalbumin or the phytotoxin or its plant toxin or its poisonous part as much, but the seeds are where you have the core amount of poison. Now, the active principle here is going to be ricin, ricinolic acid. These are the two components that are by far the most dangerous. And the ricin is actually the toxalbumin, and ricin is the one that causes all the systemic manifestations, whereas the other part, the ricinolic acid or things like that, actually called just GI symptoms. Uncrushed seeds are not poisonous. This is a hallmark feature with all plant poisons. Unless and until the seeds or the plant itself or the stem or the leaves are actually chewed and crushed and then it is taken inside, they are not going to show their manifestations. The mechanism of action for ricin, which is there in Ricinus communis, is that it has a particular component or a toxalbumin, very important here, it has a toxalbumin called ricin This ricin, once it enters the cell, is going to bind here at the ribosome level, and it is going to inhibit protein synthesis. Now what it does is, it stops fresh protein being developed. This protein is essential for all sorts of activities, ranging from transport chains to enzyme activities to energy production to muscle activity to cell repair and regeneration. All of that is effectively stopped by the action of ricin. This is what it does on a cellular level. So it enters the cell, it goes to the ribosome, and there it inhibits entire activity of protein synthesis. There is no protein synthesis going on, and all of that is done by this wonderful and beautiful looking flower and those dangerous little seeds right there. They are the ones that contain the ricin, which is the toxalbumin present in Ricinus communis, which stops protein synthesis at a cellular level, damages the cell, and causes all sorts of symptoms. These symptoms can include ones that are very simple or very generic, such as nausea and vomiting, which are what feels like something very unremarkable. Abdominal pain again indicates some viral gastroenteritis or bacterial infection. When you have bloody diarrhea, little worrisome, maybe there's something problematic going on. Thereafter it progresses and starts causing muscle cramps, it starts causing problems with the eyesight, it causes drowsiness, it can cause convulsions at a later stage, and then it causes kidney failure, respiratory collapse, hypovolemic shock, entire circulatory collapse, and death. And the whole problem is, it starts with seemingly innocuous symptoms or symptoms that are not very dangerous. The fatal dose is 10 seeds which are crushed. Ricin, as purified if it is taken, it's a super toxin. So you require just 1 milligram, maybe 2 milligram worth of it to actually cause death. But the fatal dose here, if you're taking it directly as a seed, you have to crush about 10 seeds to kill an adult male, healthy, having no premorbidities. Treatment modalities for ricin is that, first and foremost, if we do get a case in which an individual is telling us, confirming to us that yes, I have consumed ricin and it has been less than 2 hours since the ingestion, go ahead and do a gastric lavage with warm water. If it is there unabsorbed inside the stomach, a gastric lavage, 2 hours is generally considered our standard timeline in which unabsorbed toxin can still be removed by the gastric lavage. Use demulcents, it is an irritant poison. Use some sort of a CNS stimulants to keep the individual awake. If you are not able to do these treatment modalities, and of course then you have to give your supportive care. If there is an individual who is having nausea, vomiting, lots of diarrhea, give him fluids, give him IV, give him electrolyte therapy, give him oxygenation support, give him drugs that are going to let his blood pressure rise and keep his cardiovascular system stable. If PM changes, if the person dies, if the person passes away in autopsy, and unless you're aware of what caused the death, if you're unaware that it could be ricin, you're going to get non-specific features such as inflammation of the GIT and hemorrhages in the internal organs, again which are non-specific in nature, which are not going to be corresponding with poisoning, because you're going to be having a history of nausea, vomiting, diarrhea, so on and so forth. So it's actually a very ideal homicidal poison, and the worst part is it's in very small quantity and it kills very rapidly with symptoms that are innocuous or vague. This is a part of the second poison that we are going to be evaluating today. The second poison that we are evaluating today, for the people who are in the Hindi speaking part of the world, Jamal Gota is a term which is used for a agent or a concoction or a powder which is used to relieve GI distress. So if somebody is suffering from constipation, in Hindi we call it kabs. So if somebody is suffering from constipation, that individual, if he takes Jamal Gota in any form, gets motions and lots of loose motions, and it gets relieved. This particular Jamal Gota is actually derived from these particular seeds, as they are called as Croton and Abrus. This is the second toxin that we are going to be focusing today. And yes, as you can see, I have a little bit of a hair loss myself. What do you feel? Jamal Gota as a drug which is used to relieve constipation, does it actually work here? Jamal Gota, will it cause hair to improve? Okay, fine. We'll focus on that in the coming slides and I'll give you the answer at the end. Croton is the second one we will be doing right after Ricin communis. Croton is also a plant-based poison. This particular toxin is also found in nature, very commonly found across India. Nice, beautiful looking seeds, seed pods, green leaves, reddish to brownish stem. Again, this is another plant that looks very harmless, looks very pretty, but is hiding something very nasty beneath it. Croton as a plant, the seeds as well as the oil extracted from the seeds, both of these are poisonous. This is used as a herbal remedy for relieving or curing constipation in India. The seeds are oval, they are dark brown, they have certain longitudinal lines about them, and the toxalbumin, the active principle, the poison that is present inside, is called as croton. Just like Croton, this is called as croton, and Pichula, the last one, was Ricinus communis. The toxalbumin was called Ricin. When applied to the skin, it acts as an irritant, causing redness and vesiccation. This is also an irritant compound. It irritates the skin, and one of the principles behind hair growth is that we have to irritate the dormant hair follicles which are present in the skin so as to cause those follicles to be stimulated and start growing hair. This is why it is true Jamal Gota or Croton is used as a herbal remedy for promoting hair growth in individuals who have hair loss. So yes, it was not fake. Although I will not support its distribution. If you do having hair loss, go see a dermatologist. But yes, certain areas of the country, they are using this. Use predominantly of Croton comes under either being an abortifacient or as a suicidal agent. How it comes as a suicidal agent, I'll tell you in a little while. The seeds can be found in two particular forms. It's used either dried seeds, they are taken, they are dried out into the sun, then they are crushed, certain oil is extracted, the crushed powder is also used as a constipation relief mechanism, and then you have the fresh ones. The fresh ones are used in folk medicine. The fresh medicine itself, they are boiled with some water, made into a tea sort of a thing, and then given to the individual to relieve constipation. So both of these forms are available. The sign and symptom of orally consuming this particular product, either as a tea or as a oil, are that it's going to first cause irritation throughout. It is an irritant drug. It is going to cause irritation throughout the GIT. There is going to be burning in the burning pain in the mouth. There's going to be pain that is going to radiate all the way around to the stomach. Lots of salivation because you're getting pain here, getting irritated. So a lot of saliva is going to be formed. There's going to be nausea, there's going to be vomiting because this is irritating the entire GIT while it goes down. And because something is irritating, you have the desire to actually throw it back out of the system. If it is still persistent, can cause diarrhea that is watery, then progresses to bloody diarrhea. Its major action is to irritate the GIT and intake of water and exclude it out. Due to this particular loss of water, that is due to those fiery diarrheas that it causes. I mean, the water and the fluid is just exiting out of the body. Individual goes into electrolyte imbalances, hypovolemic shock, collapse, and then death. That is how the sequence of events works for Croton. The fatal dose is 1 to 2 ml of the oil or maybe 4 seeds. If you remember, it was up to 10 seeds for Ricinus communis, 4 seeds and 1 to 2 ml of oil. Crushed seeds, again seeds taken directly without crushing it may not cause all those symptoms, but here you need to have those crushed seeds. Treatment modality is very similar to Ricinus communis. You have your gastric lavage, you have your demulcents, give symptomatic treatment, And again the PM findings are going to be very characteristically vague. So both in Ricinus communis and the Croton and Abrus, you won't be able to identify unless and until you know that you have to isolate the toxalbumin, take a blood sample, send it to a lab, tell them detect or test for Croton, test for Ricin. You won't be able to conclusively prove what the cause of death was. How does a snake bite look? Indian cinema has told us that this is what a Nagin looks like. And I mean, I'm a big fan of Sridevi as well as Amrish Puri, and I've seen this movie lots of times when I was young. And you kind of see that she's kind of giving the venom telepathically. She's not even touching this person. This is not what snake bite is. This is what snake bite looks like. Correct? So if you are getting a case in your hospital and you have two fang marks surrounding with some sort of an inflammation all around the area, you can always go and say, yes, this possibly could be due to a venomous snake bite. Right? Obviously not like this. But what if I told you that there is a plant that has a particular poison that resembles the features of a viper snake bite? Boys and girls, welcome Abrus precatorius. Abrus precatorius is the third plant and the last plant that we will be looking at today. This particular plant is also called as the plant that causes a viper bite-like poisoning. So it has the features that you would find similar to what you would find in a case of a viper bite. And I'll tell you how to differentiate that also. Abrus precatorius, also called as Rati, is a plant, again, small leaves, very distinctive leaves, very distinctive stem, green color, and having these equally shaped, equal size, equal diameter, these seeds. These are the seeds where you now have the largest amount of poison or toxalbumin in Abrus precatorius, and very beautiful looking seeds, right? Look at it, very beautiful, very pretty looking seeds. But they harbor the entire corpus of the toxalbumin of this particular plant. They are responsible for all its activity, including its viper bite-like symptoms. Rati seeds, this is how Rati seeds actually look like. Very pretty, very beautiful. They are generally dual tone. They are red and black, or you might find some which are off-white and black. The seeds are the toxic part. They are sort of egg-shaped. They are bright red color. They do have one black spot. And the active principle here is called as abrin. So in Ricinus communis we had Ricin, in Croton tiglian we have Croton, and in Abrus precatorius we have abrin. Apart from abrin, there are some sister compounds also, which are of course poisonous but not as deadly as abrin. We have abrin, which is an albumin based compound, again not very toxic but again toxic nonetheless, and abralin, which is more an irritant rather than a poison, but they are also found inside these particular seeds. The mechanism of action for Ricin was that it used to enter the cell, go to the ribosome, completely stop protein synthesis. For Croton, enter the system, cause localized irritation, intake of water, GIT is badly irritated, nausea, vomiting, loss of water, all of those things cause collapse. Here in abrin, the mechanism is slightly different, and it's much more fun also. In abrin, what happens is, now you have basically two chains of abrin. It is a compound which has two chains. You have one called as an alpha chain or an A chain, you have another called as a beta chain or the B chain. Now what alpha chain basically does is, alpha chain goes and it specifically binds on one particular part of the cell wall. Once it binds to that part of the cell wall, it allows the abrin compound to cross the cell wall and enter inside, and the beta chain, once it enters inside, it then attaches itself to the ribosome similar to what Ricin does and causes elongation factors and all of those to stop being produced. So all protein synthesis is effectively affected. Again, 2 chain alpha and beta. Alpha causes entry of the aprin into the cell. Beta goes to the ribosome inside the cell, completely stops protein synthesis and further energy production. The signs and symptoms on ingestion are again very similar. You have abdominal pain, nausea, vomiting, diarrhea. All of those things are absolutely same as what you would find in Ricin or what you would find in Croton. But here is the kicker. Beta chain activity is going to damage a very, very important pathway. It is going to cause disturbances with blood coagulation factors, and now you're going to start getting bleeding. This bleeding is seen in all the mucocutaneous junctions, most prominently from the rectum. It causes deficiencies in blood coagulation, leading to bleeding manifestations. If that extract, the seed is taken, now you crush it nicely, you make an extract out of it, and you put it in any sort of a device that resembles fangs of like an injection needle, bend a needle, make it look like a fan, dip it nicely in abrin, proteinaceous abrin, and you inject it under the skin, you're going to find inflammation, edema, hemorrhage, necrosis all occurring around that sting site, exactly similar to how you would find in case of a viper snake bite. And this is why it resembles a viper snake bite. It resembles a viper snake bite. It has those 2 puncture marks. You're going to have redness, swelling, edema all around it. There's going to be oozing of blood, again something we find in viper snake bite. And all of this causes the individual to have the symptoms similar to a snake bite. Convulsions, drowsiness, coma, and death. All of those again resemble viper bite. This was mostly used for animals. One point of time, cows and buffaloes were considered property. So people used to take abrin, crush it, make a paste, make something called as a sui or a needle, and then inject the animal on 2 sites, equidistant sites, run up. That animal is now going to have viper bite features. People are going to assume it was due to a viper bite, but it's actually due to Abrus precatorius. In humans, again, very similar to viper snake bite, you're going to find swelling, ecchymosis, inflammation and necrosis at the site of the bite, and you're going to have dyspnea, difficulty in breathing, convulsions, coma, and death occurs from cardiac failure. All of this occurs similar to what we will find in a scenario with viper snake bite. It is 90 to 120 milligram, has a fatal dose, slightly higher than Ricin, and of course lower than Croton and Abrus. 2 seeds, crushed seeds. Swelling, inflammation, necrosis at the site are typical PM findings. We might get some petechial hemorrhages. We might find some sui or needle or broken bits if it is used in animal poison. And the organs are going to be very congested. Suis are the ones that were initially used as cattle poison. Again, they should take the powder from the seeds, mix it, and make a sui sort of a device and inject the cattle plant. With that, it is also one MCQ for you guys right here. I'm sorry, I'm taking very long. One MCQ for you guys. Among the following, which of the following particular compounds are used as arrow poisons? So, very commonly this question is asked. Among the arrow poisons, one answer you have is of course Abrus precatorius. And then you have your aconite, snake venom and strychnine. These are all used as hunting poisons or arrow poisons or cattle poisons. So that is one MCQ for you guys right there. If you do have any questions, queries or comments, please do mention it on the page. Thank you and have a good day.